We wouldn't have the freedom we do now had it not been for scientists like these. They've played a crucial role in understanding coronavirus, and their work on testing and vaccines means we're at a very different place now than 2 years ago.
To imagine that there was a virus that nobody knew anything about it, and very rapidly we've been able to isolate the virus, understand its function, developing vaccines, developing antiviral drugs, and trying to have effective strategies to control its spread has been truly amazing.
In March 2020, the work of these scientists changed overnight. They went from researching dozens of viruses to focusing solely on COVID-19. And of course, while the team was working on the virus, they were also dealing with the challenges of living with it. So they started using a rota system to allow for social distancing. In a bay like this, there would normally have been 4 people working, but at the start of lockdown, that went down to just 2. Many also offered to work over the last 2 Christmases when new variants emerged. They're researching other viruses again, but COVID-19 is still a priority, especially with cases so high.
What we need to monitor really carefully as time goes on is what comes next. There's no guarantee that the next one will be of the same or a lighter severity than Omicron. We may unfortunately find that in the coming years that we see variants which again are more severe in terms of the disease that they can cause. So we will have to look out for that, and we will have to make very careful decisions about when to revaccinate people.
At Aberdeen University, they've developed a new test to detect antibodies against COVID-19.
What we've been able to do in just 2 years is start off something from scratch. We collaborated with NHS Grampian, we collaborated with our colleagues in the spin-out companies, so for example Vertebrate Antibodies and AI Biologics, whereby we could use new technology to develop a test that detects COVID-19 antibodies. But the nice thing about this test is actually it can be used in any potential future pandemics that we may face.
The public response has also been crucial in reducing the spread of the virus. Debbie Sridhar became a household name within weeks of the first lockdown, as she helped the public understand why complying with restrictions was so important.
It was obviously quite scary for people, it was unprecedented, and so you're trying to take a lot of uncertainty and evolving knowledge that's changing day by day, even risk to children, risk to different groups, what's happening in care homes, and put it into everyday language that anyone can access and make decisions in their own life of how they're going to act. And so, yeah, it was challenging, but I think quite simply, so it's easy for me to talk simply.
And the message is still cautious, even as restrictions ease. These scientists predict we'll be living with this virus for many years to come. Susan Ripple, STV News, Glasgow.